So we're going to talk a little bit about NeoGraft or hair transplantation. It's pretty awesome, and if you've been watching our social media, you've seen some more information on that a lot lately. You saw my best friend Riley; he had it done, and he did an awesome job of like following through with everything. So you kind of saw it from patient's perspective and day by day, that kind of thing. So what is NeoGraft? It's hair transplantation in general, but it's follicular unit transplantation. So follicular unit, it's called FUE, follicular unit extraction. So what that means is you take one hair follicle out at a time. So the two main methods, so old school is stuff like plugs. Nobody does that anymore. It looks terrible. But the two normal methods today are follicular unit extraction, which is NeoGraft, or the strip method. Both, as far as the recipient site and how it looks where you put it, is the same. So it's still one hair follicle placed one at a time where you need it. So it looks totally natural. It's going to look awesome. But with the strip method, you cut a strip, literally, a strip of hair out of the back of the scalp. So you cut a big strip and then you suture it all closed. Nothing wrong with that method. It is negative from the standpoint that it leaves a big scar, but for most people, the hair covers it up. There's some where you can kind of see it a little bit. And there actually are some situations where the strip method is optimal because, say, somebody has really thinning hair back here, you actually wouldn't want to thin that more with taking follicles all around. You'd want to take a strip so that the density in the back actually stays the same. You just remove a section of it. So there are some roles for it. So it's not a bad method if somebody's doing that. It just has some purposes, but it is a big scar. The nice thing about NeoGraft or follicular unit extraction is that you're taking one hair follicle at a time. So everything gets shaved back here so that you can see the hair follicles. And then you take those hair follicles dispersed around this whole area so that you're not thinning in any one particular area. You're just very slightly and unnoticeably thinning the whole area. So you won't even really see that. Then you take those hair follicles and you place them in one by one. And so everything looks super, super natural. NeoGraft itself is a machine that extracts it. And it's run by a person that's highly trained and specialized in that. That's what they do all day long. And they're taking one follicle at a time. Super great patients. There are, I think it's called SmartGraft, and there's some different names. Some of those are robot driven, that sort of thing. I really don't think there's probably any true difference between the two. I kind of like the person doing it because they're actually really looking at the angle of that hair follicle, hair shaft as it's coming out, so that they're making sure they're taking the graft at the correct 90-degree angle from its growth so that you're not transecting it. That's why we get a 96% survival rate with NeoGraft, which is pretty awesome. So 96% of the hairs that we move are going to live, so that's good. But those get taken out and they get replaced. So that's kind of the basic concept of NeoGraft. It's a day-long procedure. There's videos out there that I've done before that tells even more of the details of it. But it takes about a day, the better part of a day, depending on how many grafts you do, 6 to 8 hours, sometimes 9 hours. People tend to do somewhere between 1,500 and 3,500 grafts is the average. But great procedure. It's awesome if it's something that you're a candidate for and want to do.